sleeping by the person
Yes.
would note.
Yes, exactly. In fact, that's the commonest thing. They'll tell you he snores a lot.
But for the person himself, I assume the most common thing would be, I'm always feeling tired.
Yes,
That's
fatigue.
good enough to take you to the hospital, isn't it?
Yeah, but some people just think it's something else.
Okay, so how do you get to diagnose sleep apnea? Because some of the things you've mentioned sound pretty normal, like it happens, or sound like there could be something else wrong with the person. How do you get to pinpoint that this is sleep apnea and then evaluate it?
Okay, precisely. It's a clinical condition. So the sleep medicine specialist will have to examine the patient, take a history. Patient comes to see the patient, ask questions. You want to know about sleep pattern, the sleep diary. Then, of course, you actually ask, I said, either the wife or the husband or anybody stay in the house with the person. Then we do some physical examination to really see, maybe there are features we could see.
Yes, that's what I'm interested in.
Okay.
How do you look at a person and suspect?
Okay, all right. We have what we call anthropometric measurements. Now, one of the major likelihoods is obesity.
Okay.
Overweight, we use the BMI score. Once someone is overweight, he has a propensity to sleep apnea.
So that's one of the risk factors.
Yes. 2, we have what we call the neck circumference. For a male, once his neck circumference is more than 17 inches, there's a high likelihood that he has sleep apnea. For a woman, 16 inches. Now, of course, when we look at there's something an organ in the upper we call the uvula. It's usually inflamed in sleep apnea, because you are snoring, it has a lot of issues. Then we have to also look at some of the anatomy of the upper airway. Some are abnormally positioned anatomically. So those things, so there's something going on wrong here. And those are some of the features to see.
Okay. I'm being told that we need to go on a break.
Okay.
So soon. We'll need to go on a break. We'll be back in a minute. Welcome back. It's still Health Matters, and we're discussing sleep apnea. This is the time that you can call in. Your comments and your questions will be welcome at this time. The number to call is 01206 842. That's 01206 842. I know you call it sleep apnea, but is it possible that these people can be awake and have an apnea, an interruption in breathing?
No. When they are awake
doesn't happen.
For obstructive sleep apnea, no. They don't have interruption breathing.
Then I assume that the body compensates in some way because, this happens during sleep. It's an interruption in breathing or a stoppage in breathing.
Yeah, both ways.
And that wakes the person up.
Okay, that's where the compensation comes in.
Okay.
Now, when you don't breathe at night, the oxygen level of the body goes really down. We know that can lead to death. So your body, instead of saying, okay, instead of going to die, I'll wake you up.
Okay.
So you wake up to resume breathing. So that's the compensation the body usually gives. The brain has to wake up.
Is it possible, can it happen that the compensation is not enough and the person doesn't wake up?
Now, compensation in the sense that there's a problem. The body knows there's a problem, but you don't know there's a problem. So really, it's more like holding you alive till you can solve the problem.
Okay.
That's how I will interpret it.
Okay. Do you have non-obstructive treatments? I mean, non-invasive treatments for sleep apnea?
Oh, definitely, yes. We have a modality. We start from the top to the bottom. Now, the first step we start with the patients is what they call behavioral modifications.
Okay.
Number one, weight loss helps a lot with getting rid of the sleep apnea. Now, it doesn't work for everybody. We also have what we call sleep positioning techniques that can help you, that can improve your sleep patterns. Then we now have the best ways. Actually, we reserve the invasive for the last. We have what we call devices or ways we can use to help you to improve your breathing.
Let's have a minute. A call is coming in. Hello? Hello?
Hello?
Is your name and your question?
Hello?
Hello? We can hear you.
Hello? Hello?
Hello? Go on with your question.
I'm Olubowale.
Okay.
Yeah, thank you for this wonderful program.
Do you have a question?
Yeah, the part related to erection. I'm interested.
Unfortunately, are you hearing any of this?
Is there any solution?
I'm sorry, we're going to have to cut this. Do try again, because we were not hearing what you were saying. Yes, you were talking about non-invasive treatments.
Oh yes, they are. They are non-invasive treatment modalities. You know, we call them oral appliances. We call them continuous positive airway pressure, and then those are the major ways, and those give you instant. Depends on the grade.
Appliances, these are things you put in and leave there.
Yes, they are modified, adjusted to your anatomy of the upper airway. Put there, so when you're asleep, they help adjust the positioning anatomy of the upper airway, so you can breathe.
And these things are comfortable enough to live with.
Oh yes, they are comfortable to live with. Very comfortable. Remember, you are asleep, so you really don't even know what's there.
Is it something you remove during the day and fix in at night?
Yes, yes, you do that. You do that.
It's not a permanent appliance.
No, it's not. We have some permanent appliances. We give you a host of options, or range of options for you to choose. We have the permanent ones, we have the non-permanent ones. If you want to remove it, when you wake up in the morning, just remove it. It's fine. The one, the permanent one, it's available. So that's how it goes.
Okay. So, is it possible for someone to outgrow this condition?
Well, I won't use the word outgrow. It's overcome, because the truth is that it gets more common as you grow, especially in the male factor. So what I said is that losing weight helps a lot. But you know, testosterone, the hormone specific to men, actually increases the muscle bulk and also causes that.
Okay.
So you can't really overcome that, really. So there are some other modalities also help to adjust to that.
What sleep position is good for someone who is suffering from?
Okay, number one, there are two positions: sleeping on your side, okay, or sleeping upright. Not too comfortable.
Upright. That means you have to put your pillow and
Maybe
actually
like
raise your body.
Exactly.
Okay.
Those are the good that can help.
Okay, now what of the remedies that are invasive?
Okay.
What are those remedies? Do you go into surgery for
Yes,
this?
yeah. Their surgeries can be performed. A series about almost 5 different types of surgeries can be performed, and these are based on what I must mention must go through a test. It's called a polysomnographic test, overnight sleep study, in layman's terms, sleep study, to actually exactly know what the problem is and where the problem is coming from. Then the surgery can be done. The surgery can now be done to try and reduce that.
Okay, we have a call coming in. Hello.
Hello, good afternoon.
Good afternoon. That's Eyo or Eto from Lagos. Please,
Yes,
let's have your question.
Good afternoon, doctor. I want to ask the doctor some questions on this issue of relaxation that can help somebody with a sleep problem. Do you mean because I know there are some exercises, I think it's not been so well organized in a society like us. So what are the, before you leave, sir, what are the exercises that can help one to relax? To help one relax and sleep? Because
yes,
there must be a solution.
Thank you very much. Thank you. I think he's talking about sleep hygiene.
Okay, yes, he is.
Methods that will get you to sleep well and improve.
Yes.
What are those?
Okay, basically, you said earlier, sleep hygiene. Number one, we encourage you 4 to 6 hours before your sleep time, avoid any strenuous exercises, avoid any active duty. Okay, number two, let your bedroom be your bedroom to sleep, not to watch TV, not to read actively, just more of relaxation. Then we advise you don't take beverages, just need time to sleep. We're talking about
no cocoa?
No cocoa. You avoid, well, it's not, some of these, the point is actually avoid caffeine, you need the time to sleep. So some of our chocolates actually have this caffeine, actually major of them. So tell you to avoid it about some few hours to sleep. Of course, avoid eating too near your bedtime. Then we also encourage that when in your bedroom, when you're about to sleep, don't have bright lights.
Okay.
have very dim lights.
All the things our parents taught us.
But those things work a lot of wonders,
Okay.
you know. And we don't take your office home. Don't take it into your bedroom. You know, when your body understands that when you're in the bedroom, it's time to relax. Your body needs to adjust to the fact that, okay, it's time to sleep. But when you're thinking at the bedtime, you start thinking about tomorrow, then you're causing problems for yourself.
Now, you said avoid strenuous exercise.
Yes.
Are there some exercises that actually help you sleep?
Well, yes, exercises help you sleep. As number one, they actually help you in terms of keeping fit, losing weight, but it
Okay.
has to be done at the right time.
There's
That's the
another
issue.
call coming in. Hello. Hello.
Hello.
Welcome to the show. Please ask your question.
My name is Badmus.
Bad
The
boss.
question I want to, yes, of course.
Please ask
My
your question.
question is this. I'm unable to sleep naturally. I always place myself on drugs, but sometimes not okay. Please, I want to ask the doctor, how can I improve my sleeping without using pills or drugs to sleep?
Thank you very much. I think that is very important. Lots of people have to help themselves sleep with some sort of medication. Is there a way you can wean them off this medication and give them some techniques to sleep better?
Well, as I said, the first step is diagnosing the exact kind of sleep disorder they do have. That's the first step, you know. Fine, to get weaned off drugs are to assist. Yes, they can. Some can be weaned off drugs, while some can be trained, you know. I said there are a lot of different kinds of sleep disorders. So it depends on the exact kind of sleep disorder you're dealing with.
So Badmus needs to go to see a doctor.
Yes, that's the best bet for him.
Now, children, before we close, a child with sleep apnea cannot express himself. Doesn't know why he's tired. He's probably irritable, crying. How does one handle it? You don't sleep with a child. How do you know this child has a problem and it could be sleep apnea?
Okay, luckily for us, one thing you know is that the child just sleeps excessively at school during the day. So you need to ask, the teachers need to be aware of this fact. They sleep during the day in class, they're always sleeping. So number one. Then number two, you find the child is restless. You know, then we have what we call attention disorders and learning difficulties. You know, they're beating a child, it doesn't seem to grasp. It can be a problem with sleep.
So beating should be the last or not even an option.
It should not be
because
an
there's
option.
so many problems that make people end up beating a child and he could just be having sleep apnea.
Yes, in fact, a child going to the hospital regularly because of upper airway respiratory infection, it could be a problem with sleep apnea.
So the teachers should liaise with the parents about their child's performance and how he's acting in school. Thank you very much. I'm afraid our time is up.
Wow. Okay.
It was a wonderful discussion.
Thank you very
Thanks,
much.
viewers. It's been incredible having you. And, you know, some of those questions, just wonderful. Let's do it again next week. And you have a beautiful day. I'm Mary Alale Yusuf.